Good morning, Dr. Lipman.
Good morning, Susie.
Thank you so much for joining me for this Wellness Unwrapped podcast. This is actually the second time that we've spoken. I first met you around 4 years ago when I was in New York for my nephew's wedding, and I popped into your fabulous center, and you very kindly allowed me to make a tiny video. I think it was 2 minutes long, where you gave me your top tips for health. And you were actually the first doctor who I interviewed. So I want to thank you for giving me the time that day. I found the 1111 Wellness Center absolutely fascinating. And I'm very privileged to be able to ask you a little bit about it today. So thank you.
You're welcome.
So just for listeners who won't have been to the 1111 Wellness Center, which I imagine is most people listening, I just want to tell you that my first impressions of it were that I had never seen any sort of medical practice that looked anything like it. It's full of personality. It's very homely. I recall there being wooden kind of figures, like sort of, and cushions, and it was very kind of ethnic. And it had a very warm, personal feeling, which I'd never seen before or since. So can you tell us a little bit about your ethos for the centre, why it is so different from anything that you would normally come across?
Right. Isn't that sad to say that's my centre is so abnormal? Most doctors' offices are so sterile and clinical, and, you don't feel at home. You feel you like in a doctor's office. And the idea was to make people feel comfortable when they come in, because what I'm practicing and what we do in the center is not traditional medicine. So, we trying to help people get better. We're not, it's a different, as you said, it's a different ethos. And my wife actually was instrumental in designing it, and she made it feel like home with a lot of African beaded ndebele aprons that when I worked with the ndebele. There's some beaded African artwork that I'm close to. So we put a lot of personal objects in, and then I'm very fascinated by Buddhism and Tibetan Buddhism in particular. So there are Buddhas all over. And so it's a real mix of, the East. There's some things from India as well, and Africa. And then it's just very calm, and, we want people to just chill out. In New York, people tend to be uptight. So the idea was you walk in and you're going to feel much calm and relaxed as you walk in.
Yeah, and I wasn't coming as a patient, but I immediately felt that homeliness. And it makes sense now that you've explained that your wife had a lot of input in the decor, because I felt like I was in someone's living room. And it was the polar opposite of the clinical feel that you would normally expect, very sterile. So, and the other thing that really struck me was the team that you had put together under one roof, which was something I hadn't seen before. Like you had, there was a physiotherapist there was a psychotherapist, there were health coaches, and you were working in a very integrated way. So can you tell us a little bit about why you feel it's important for patients to have access to that sort of team?
Yeah, because there's so many aspects of our health, and, it's very hard for one person to do all those things well. So I've been using health coaches for many years because, when people come and see me, it's all very well to say to them, you need to go on a paleo diet, or you shouldn't be eating gluten, or, this is how we want you to eat. And they this is what I used to do in the old days. And then they walk out and they say, well, how do I do that? So I started using health coaches many years ago to help patients implement the changes that I recommended, because I found, it's one thing telling someone what to do, but if they don't know how to do it and they don't have the information and the specifics on how to do it, it's very difficult. So the health coach has changed my life. Instead of having to answer tons of questions, emails, phone calls, is this right? Or where can I get gluten-free? Or where can I get grain-free? Or et cetera, or, which is the best type of produce to buy. So the health coaches basically hold my patients' hands. And, same as having a coach in the gym. A health coach has been that aspect of how I help my patients. So I always work with a health coach now, for many years. Even when we do virtuals, which I'm doing more and more from all over the world, there's always a health coach on the call to help people implement the changes that I recommend. And then in terms of, emotional health is important. Having a good therapist is important. The therapist now happens to be my daughter in my office.
Oh, how gorgeous.
Although she had a baby recently, she's working from her apartment.
Congratulations.
But, and then I have a really good physical, I have good body workers because I think musculoskeletal health is really important. I have a compounding pharmacist and someone who's my expert on supplements. I have a holistic cardiologist because as I get more into longevity medicine, checking biomarkers and lipid panels and having a cardiologist help is really important because the heart being so important as we get older and what everyone is concerned about. So it's just, we all work with the same goal in mind to get people healthier.
Yeah, I love that. And just to pick up on what you said about the health coaches, that day that I came into the centre, you very kindly invited me to spend some time sitting down with your health coaches and listening into what they were doing. And what I recall most about that, which I found so beautiful, was your office was actually right adjacent to theirs. And you came into their office, you were just standing in the doorway and you said, I just want to tell you guys that the patient I've just seen, Mr. So-and-so, and I can't recall which marker had improved. I don't know if it was HbA1c or something, but had improved drastically. And you came to report that back to them because you knew that they'd been instrumental in that and you valued their input and you wanted them to know that this patient had improved and they were really happy. And it was just a beautiful example of teamwork and how doctors and health coaches working hand in glove to get better outcomes. So it really made an impact on me.
Great. Yeah, it's people love I personally love working with health coaches. The health coaches learn a lot and the patients love having health coaches. That everyone's happy.
Yeah. So I would love for you to talk a little bit about your time before you came to the US, because the first time I ever heard you speak, which I think would have been around 6 years ago, what struck me most, and I can recall this quite well, was I had never heard a doctor who had spent time in the bush, and not only had spent time in the bush, but was showing the humility to have actually learned from these indigenous healers, who I think a lot of people would call, I don't know, maybe witch doctors, or they would see them as quite, I think, primitive. And yet you were coming from having studied sophisticated, forward-looking, cutting-edge Western medicine, and then you were actually learning from people who had never studied medicine and yet were healing their communities. So I would so love you to tell our listeners a little bit about that.
Right. Well, to be quite honest, in those days when I just came out of medical school, that was in 1980, 81, so it's a long time ago, 40 years ago. I was I thought Western medicine had all the answers. So it's not that I was I thought that, I went to work for 6 months, or even more in the bush. But I didn't really think their medicine worked when I went there. I had no clue on how it worked. I was fascinated by the whole cultural aspect of what they were doing. And while I was there, I noticed that, a lot of the patients that we couldn't help were being helped by the Sangomas. And not that I actually believed in what they were doing, but I realized the importance of the cultural aspects of healing. And as the Dalai Lama says, the three most important aspects of healing is the belief of the practitioner, the belief of the patient, and the karma between the two. And, the cultural aspect of healing is really important. We believe in our doctors. So you go to a doctor and they give you an antibiotic for a viral infection and you get better, not because the antibiotic helps the virus, but because you believe that the doctor knows what's going on. And so your belief system is really important. So that was the part that fascinated me. And I was always growing up, I happened to grow up in a very liberal house in South Africa, which was sort of unusual in those days. And I was always intrigued by African culture, whether it was their music or whatever it was. So it was the culture that intrigued me. And in those days, I had no clue about the medicine or even any interest in learning what they were doing, except that I realized then that there's obviously a huge cultural aspect to healing and what we believe. And so that was very instrumental in how I thought about medicine and how I practice medicine, how I realized that when whoever sees you, the relationship is really important, and how they leave the office, where they believe in you and believe in what you're giving them, whatever it is really important. So it did change the way I thought, but in all honesty, it's not that I thought that traditional African medicine was that good per se, because I had no interest in even learning it. I mean, I'm more intrigued by it now and in all other medicines since I've studied Chinese medicine. But in those days, I was still a strong believer in Western medicine, and I thought that we had all the answers. It was just eye-opening to see these patients getting better with, medicine that I thought was quackery.
Yeah. And yet a lot of people would see what you referred to just now as Chinese medicine also as quackery. So can you tell us a little bit about why you integrate these so seamlessly? Because I know one thing that struck me very much when I met you in New York was that you do acupuncture on your patients yourself. I'd never seen that before. I'd never seen a doctor either prescribing acupuncture for every patient, but doing it yourself I just found fascinating. Why is it that you are melding together? You've got the cutting edge sort of science, and then you've got these very ancient healing practices, which you have made sit side by side quite seamlessly.
Yeah, and that's what I do in my practice. I'm taking a lot of what we would call lifestyle changes now, a lot of this ancient wisdom, whether it's about meditation. There's so much wisdom in so many traditions, and I combine it with, the latest science. But first of all, why I do acupuncture is because I love the experience. I think, acupuncture can be and often is a very intimate experience. So you get quite close to a patient. In Western medicine, we hardly even touch people because it's, for whatever reason. So acupuncture is firstly it makes you, often the relationship gets a little bit closer, not in any sexual way, but you just, there's this intimacy in a way that is, I've always enjoyed and thought was important. But, why I got into it was when I left South Africa and I came to the States, I had to do a residency in internal medicine to get a license in New York. I had passed all my exam, and when I came to New York to get a license in New York, they didn't just accept my exams. I had to do 3 years in a residency, and I happened to choose internal medicine because I wanted to be a GP, as my training in South Africa was like a British GP. But when you come to America, it's very different. And when you get put in a hospital, there's no relation. The importance of relationships are not emphasized. It's all about taking bloods, sending people for X-rays and EKGs, reading up about all of this and then presenting it to the professor the next day. There's no emphasis laid on taking a good history and exam. So the medicine was very different, and I was very disillusioned. And I said to my wife, I don't want to practice here. And this is not what I signed up for, and I don't know what I'm going to do because I don't want to be a doctor in America. And there happened to be an acupuncture clinic which was doing detox. This was 1984, and I was doing a residency in the South Bronx of New York, which in those days was a pretty burnt-out area full of heroin and crack addicts. And that's how I got in, because they sponsored me for a green card, because American doctors didn't want to go to hospitals in those areas. And because I was disillusioned with Western medicine, I went to check out this acupuncture clinic because, actually, the GP I worked with in South Africa had given me a farewell present of the Barefoot Doctor's Manual, and he said, check out acupuncture. So it just all happened, and I went to the acupuncture clinic, and I saw that they were helping patients that we weren't helping in the hospital. In the hospital, we were doing acute crisis care medicine. We were treating acutely ill patients, and it was helping. We were using antibiotics for pneumonia. We were treating heart attacks. We were treating broken bones. I was going to the acupuncture clinic, and people were coming in. They were tired and they couldn't poop, and they had headaches. And I saw the acupuncture and Chinese medicine working, and I realized that the future of medicine would be some combination of the two, because the two medicines were working with completely different patients. And where one was strong, the other one was weak. And where the other one was weak, like Chinese medicine, if you're acutely ill or you break a bone, acupuncture is not going to help. So it was very obvious in the mid-'80s to me that the future of medicine would be some combination of the two, because there were so many deficiencies in Western medicine, however effective it was for crisis care. And then I saw the benefits of Chinese medicine. So it wasn't such a hard choice for me or decision for me to make, because it was like right in front of me. It was so obvious that I thought, well, this is what I want to do. I want to combine the two. And, I didn't want to let go of my knowledge of Western medicine, where I could still help, maybe 10 or 15, 20%, whatever patients that would come to you because they were acutely ill. But most of them I couldn't help. So it was just another way of developing my skills to help, a greater percentage of people that I would see.
Yeah, I love that. And I don't know too much about traditional Chinese medicine, but from my understanding, it really looks at the person as a whole. So the physical, mental, spiritual, emotional is all interrelated. It's all one continuum. And we talk about the concept of qi, which is really hard. I always find that very hard to explain to people, because of course you can't dissect it or measure it as such. So I would be really interested to hear how you as a doctor would describe this concept, which underpins all of these things, whether it be acupuncture or qigong or emotional freedom technique, which is what I do to help people through their emotional blockages. How would you describe this concept to people who were not familiar with it?
Sure. Well, first of all, it took me many, many, many years to try and understand what I was doing, because I was living in two completely worlds, practicing two completely different medicines with two completely different philosophies. So it did take me a long, long time to work it all out. But, it's a completely different philosophy and a different way of looking at the body. In Chinese medicine, we are a microcosm of the macrocosm. So, we are affected by the external world. So, for instance, I'm digressing a bit, but climate change, to the narrow-mindedness to think climate change and what's going on in the environment is not going to affect our inner environment would be just something in Chinese medicine which doesn't make sense, because that would be the way you understand things. So that's the one concept. The other concepts, in Western medicine, when you have a symptom, you have heartburn, you go to the doctor and he gives you a drug to suppress the heartburn. In Chinese medicine, that symptom is a pointer to some imbalance in the system, because it's often about creating balance. So if someone has heartburn, you have to see why the heartburn is there. What is triggering the symptom? What's the underlying issue, imbalance, that making someone present with heartburn? So you don't necessarily just treat the heartburn, you try to treat the imbalance. And the other concept in Chinese medicine, which is important, which will lead to the qi, is the idea of health is not either black or white. There's this huge gray area between the black and white, between health and disease. And your job as a practitioner is to take someone from maybe a darker gray to a lighter gray, whichever way you want to look at it, but you move them along the spectrum. There's an aspect of improving function. So it's not either your gut is working or not working. It's working 20% as well as it should work, or 80% or 100%. So you as a practitioner are there to help improve the functioning of the organs. Now, the last concept, which sort of flows out of that functioning, is this concept of energy or qi or prana. All cultures have had this concept of energy, and we just don't have it in the West. Although now we sort of finding out, when after years and years of trying to work out what the hell is qi, what the hell is energy from a Western perspective, we now know that the mitochondria are these energy powerhouses in our cells, which to me are the equivalent of our qi. And how you affect the mitochondria is going to affect how you affect your energy. And we also now know that there's fascia, there these this connective tissue runs throughout our body, and we know that the acupuncture meridians actually run through the fascia. So between all your organs, when you open up a chicken, there's this connective tissue that you have to cut away. So we have this fascia throughout our body, which connects us from head to toe. And now we know that those meridians that they talk about in Chinese medicine are just these pathways that run through the fascia. So we sort of have a better understanding of how it's just two different languages, but now it doesn't. To me, it's not an either or. It took me many years. I had to either have a Chinese hat on or a Western medicine hat on. Now, especially with functional medicine, which is what I do, it sort of combines the two. You're still using that philosophy of improving function, creating balance, the concept of, freeing up energy, improving function. It's all towards the same end, to get someone healthier.
Yes, so beautifully put. And I definitely resonate with that, what you mentioned about functional medicine, because when I first started working with energy, when I became a Reiki practitioner, which would have been about 11 years ago, I was so excited about this whole concept of energy that I would try to explain it to my doctor friends. And I remember one of them just kind of patting me on the arm and saying, "Susie, if it makes you feel better to think there's an invisible energy body, then that's great. And I kind of gave up after a little while. But when I first started my training as a functional medicine health coach, one of my first lectures, if you like, was by one of the doctors, I don't recall which one, but she was talking about the therapeutic encounter between whether it be a coach or a doctor and the patient, and how our heart energy, is much bigger than our physical body and actually will affect the patient outcomes and how the patient feels. And I actually remember I cried because I couldn't believe I was listening to a medical doctor talking about the energy body, which I was so familiar with, but which had always been poo-pooed. So it's really refreshing to see it all coming together. Yeah.
Yeah, it is coming together. I think in England, as far as I understand, it's much more separate. You guys have a weird system, how it works. Like, the whole alternative world is completely separate. Even the few more holistic doctors I know in England don't really get the functional medicine aspect. So, and functional medicine is really a combination of the philosophy of improving function and creating balance with the Western understanding of biochemistry and physiology. And it's become much more of a accepted way of practicing here in America, which is interesting change. I mean, when I first started, was hardly existed. But I've seen the changes. I think that's a good thing in America. They tend to embrace these type of changes more easily. In older cultures, I think it's harder, to be quite honest, to change old ways of thinking. America is very good about embracing new. It's good and bad. I mean, it's good and bad to everything. But as a general rule, they've embraced this, and what we do has become very popular. And there's so many great tests we can do, and there's so many more windows we have into someone's health that we never had before.
Yeah, I really hope that we do catch up. We are a little bit behind in the UK, that's for sure. But I think I really hope that anyone listening to this who is involved with healthcare on some level could maybe see that there is a way for different disciplines to come together under one roof, where it's very accessible for the patient and where all the practitioners are talking together, which I found so lovely. And it's amazing that you've got your own daughter there as well. I think there's just a lovely feel about the place. But I think the main thing is you're focusing on the person, aren't you, rather than the disease?
Exactly. Yeah. Exactly. And I mean, and that's, from that comes from Western medicine. What's his name? One of the fathers of Western medicine said it's more important to know the patient that has the disease than the disease that the patient has. And so, yes, what I learned initially in Chinese medicine, where in the hospital, if someone had asthma, everyone got treated the same way. And when I'd go to the Chinese medicine clinic, 5 patients would come in with asthma, but they got treated very differently. So, treating the patient as opposed to the disease is a primary concept in what we do in functional medicine, what you do in Chinese medicine, which is a lot of this is just common sense. This is what's so strange. In the early days, I was fighting the system, and now I don't really. If doctors don't want to get it, they don't want to get it. And, it's like, I've been doing this for long enough, and I've seen enough to know, I still get called a quack, and I still get, whether it's on Twitter or whatever, and when patients get referred and they think whatever, because I'm recommending diets or supplements or meditation. But, when you're seeing people getting better all the time, and these are people who haven't been helped by traditional medicine, then, you don't give a shit anymore, excuse my language.
I couldn't agree with you more. And the thing with something like meditation, it's such a safe thing to do? I mean, there are no side effects. So why wouldn't you encourage somebody to de-stress when we know that stress causes inflammation in the body?
Well, I think doctors understand that stress is a problem, but they don't have any tools to help people deal with it. But I do think, my whole philosophy is I'm not attached to any philosophy. I'm not attached to Western medicine, to Chinese medicine, to functional medicine. People need to find, my job is to try to teach people and to help them find a way to better health, whether it's through EFT or whatever. I mean, I think a lot of it is determined by the connection they have with whatever practitioner they work with. And so I'm not attached to what I do or what people do, and as long as they're happy and they're getting better. But I agree with you. I think a lot of what I'm recommending is pretty benign. I think I don't, probably now I don't get as much flack for recommending meditation or even acupuncture, a little bit maybe. I still I still get flack for supplements or recommending supplements. There's still a lot of, there's, a lot of pushback against supplements. But to me, targeted supplementation can be is very helpful. So I use very targeted supplementation, which, whether someone has an altered microbiome or a leaky gut or, a concept that Western medicine doesn't accept, adrenal fatigue, or when someone is very tired, I see adaptogens helping. So, I don't give a damn anymore if people call it quackery or there's no science, and we can go into the argument of what's science and what's scientific and what's not. But I'm just about what helps people. And if people are getting better just because they believe in the supplements and it's not the supplements, that's fine. I mean, I believe the supplements work, but if people getting better just because they believe in it, that's fine by me. As long as someone's getting better, why do you want people to suffer and adhere to a dogma which is not working for them?
Yeah. And I think you've hit the nail on the head there, that if people are getting better, because you're not looking for people just to have an absence of disease. You want them to actually feel healthy, to have optimum health, which is quite different. They're two very different things, aren't they?
Absolutely. And especially as you get older, now that I'm 66, I'm getting older, I'm more interested in, I've got a grandson and I want to stay healthy and vital and, see my grandson grow up. So it becomes more important. And I think people are getting it, that, the idea in the culture is as you age, you become more disabled and more your cognition declines and all these horrible things start happening to you. And that's because of a decrease in function. And if you can optimize function, you're going to feel better. And we've seen this with COVID-19. When we're talking about optimized function and supplements, vitamin D. So now people are realizing supplements are important, and vitamin D. Okay, so people will maybe somehow accept that vitamin D is important. We now, there's a lot of research showing that, people with higher vitamin D levels have better outcomes with COVID. People who are metabolically healthy. So to me, that's optimizing someone's metabolic health. There are other systems, areas you can optimize, but people are understanding that sugar dysregulation or disoptimized metabolic health, whatever you want to call it, has negative consequences to COVID. It's just so interesting how, even more holistic doctors put everything in boxes. The whole body works together. How you sleep is going to affect your immune system. How you move in your body, how you deal with stress. So it's all about optimizing your health. And there are many different ways you can do it. Being kind to others, having gratitude, volunteering. These are all, laughing at yourself, not taking yourself so seriously. These are all ways of optimizing your health. They may be more intangible and harder for traditional doctors to accept, but, they work.
They absolutely work. I mean, the differences I see in clients when they start helping others and practicing daily gratitude, it's just extraordinary. It's like they undergo an entire transformation and the ripple effects just continue. So these soft interventions are hugely powerful, as you and I know. And what I love about your books, which I find so easy to read, I don't know if you remember, when I came over, I actually bought, I bought all your copies of the...
I have a new version of that called the New Rules of Aging Well. I don't think it's out in England yet.
Right.
But the New Rules of Aging Well is sort of the same model, taking little tidbits of information with images and putting it out there.
Yeah, I love this book so much because very often when I see people, they're a bit overwhelmed with books and they get they get a little bit overawed by a very heavy kind of medical sounding book. But I give them this, it's got really nice pictures in, and it's very kind of just bite-sized, and they read it in bed. They're just like flicking through and they'll just pick on something, think, oh, oily fish, or taking a few breaths or something, and they start from there. So it's a very inspiring book.
Right, and that's what I try to do with my books. That's exactly what I try to take this complicated, new research, mix it with old ancient wisdom, and put it in bite-sized tidbits so people can, access it and realize that it's not that difficult.
Yeah. For example, I can't remember which book I was reading of yours, but you had a section on music, on the power of being in the car and putting music on really loud and how that completely shifts your emotional state. And such a simple thing, but it's not often talked about by healthcare practitioners as something that can help you feel better.
Right. And most cultures have always known this. I mean, when I was growing up in South Africa, in the African cultures, there's music for weddings. There's, music for different situations. Music just became entertainment. Who knows when? I'm not sure exactly when. But our culture sees music as entertainment. But music affects you quite deeply. I mean, I always recommend, for instance, if someone wants to relax, put on some reggae or Bob Marley, because the beat and the rhythm, beats at about 60 beats per minute, which is the beat of a slow heartbeat. So your body entrains. There's this concept of entrainment where your body entrains to surrounding rhythms. We all know when we're at the beach, for instance, we slow down, we're in traffic, we speed up. Same things happens to music. You put on Bob Marley, you slow down. You put on some heavy metal, you'll speed up. So, yeah, I think, I use music in my practice. When I give people acupuncture, I put on special CDs that actually, work with brain waves and get people to entrain to the rhythm. So music is not only part of my personal life, but I use it as therapy in my practices and I think it's becoming, more and more people are realizing the power of music and how it can affect brain waves and moods. And this is my whole philosophy, whatever works. And, most cultures have known a lot of this, but we're so enamored with the scientific method that, where's the proof that music works? Well, wait for the proof. I remember in the old days, not that I think everyone needs to be gluten-free, and gluten's a big problem in England, but I remember 20 years ago when I took people off gluten and they felt better, and everyone said, well, where's the evidence? And where's the evidence? I said, well, I'm not going to wait for evidence if people are feeling better. The evidence will come, and sure enough, it's come that we're realizing more and more people are sensitive to the gluten grains in America. It may be different in England. Not everyone, but there's a good percentage of the population that does better. So I use what works when I see what works. When patients come back and when blood results change, that's what I believe in, rather than any dogma of everything's bad or good, or there's no science behind it.
I think that's such a wonderful ethos to turn away from the rigidity and learn from the patients, which is what you've been doing. And just, as you say, going with what works. And isn't that what medicine is? It's making people, or should be, is making people feel better. And, if it's music that makes them feel better, then do we need a research paper on it?
Yeah, and I'm not against research, and I think it's important. I'm just, I'm observing clinically what's going on, and I want the research to happen, and I'm all for it, but I will go with my observations until, something changes my mind.
Yeah. So just to wrap up, in this very, very difficult year that we've had, when people are feeling so stressed and overwhelmed and are probably suffering from all sorts of physical, mental, and emotional things, and they don't know where to start, what could you just point them towards as a starting point?
I think it's the ordinary things that we do on a daily basis that have extraordinary effects on our health. Whether it's listening to music, being kind to others, we talked about volunteering, having gratitude. When you go to sleep, going for a walk early in the morning. When you eat, I've become, especially as we get older, a bigger and bigger proponent of fasting. So there's so many little things that one can do to feel better, and don't just wait for a pill or a drug or a doctor to tell you something. Just realize it's, what you do every day changes not only the way you see life, but the way you're going to feel. If you're passionate about something, whether it's your kids or some, your job, I think doing what you enjoy doing, finding something that gives you joy, and not taking yourself so seriously. And it's all about, I always tell my patients, it's the lenses we use to see life. It's like you can change the lenses, and sometimes that's all we need, is just to change the lens of how we're seeing life.
Wow. And that's such an inspiring, empowering thing for people to hear who are feeling a bit stuck, to know that it's never too late to change those lenses and to start to find meaning in life, and maybe start to see how, even if you're not in the best health, you might be able to help somebody who is in, a worse state than you are.
Absolutely. And now that I've gotten into longevity and aging, obviously selfishly, but now that I'm putting it out there are more and more studies about how optimism, how people who are optimistic age better, people who volunteer age better, people who are surrounded by loved ones or have community age better. So all these things are important. It's not just what you eat. It's not just if you're exercising and how you sleep, which is all important. I'm not negating sleep and exercise and diet. I just think there are all these other aspects that you don't realize are going to either make you healthy or can affect your health, which are so important.
Absolutely. Amen to that. And I want to thank you for your beautiful, holistic ethos, your approach to helping people. And I really hope that one day we see something in the UK that is at least a little bit similar to what you've got in New York.
Okay. Thanks, Susie.
Thank you so much for joining me. Take care. Bye-bye.